council. Some of the obstacles we identified really came down to knowledge, and it came down in a lot of different ways. We identified outright lack of knowledge. There's a lot of turnover and burnout in the nonprofit sector especially. One of the obstacles we identified in particular is knowledge of what's called vicarious trauma and adaptive coping strategies. A lot of our young staff especially are never taught that this is a real phenomenon and that working with people in trauma causes trauma, and it's something we need to learn to cope with, and that it's not a problem with the staff themselves. Another area we got was distortion of knowledge. In a lot of the areas we work, there's a lot of bureaucracy, a lot of red tape, and oftentimes filling out the paperwork, complying with the laws, distracts us from the work we're really doing. And then finally, was communication of knowledge. And one particular issue we saw was balancing the need for sharing information with the need to protect our clients' privacy and confidentiality rights. Salim?
Okay, so breaking through and finding cheap and creative solutions kind of go together. And a lot of it just comes down to education. Educating our staff on resource counseling, supporting those who provide support, so that there isn't as much burnout, there's not as much turnover in those agencies. Also, an agency exchange program was suggested where people from different agencies spend time with each other so that they can learn about the other agency and what they're doing, and we're not duplicating things and competing with each other, but more collaborating with the agencies that have the same intention. Also, agencies with different intentions to make sure that we're covering all of our bases. So agency-to-agency communication and exchange program. And then we need more communication between the government agencies, the nonprofit agencies, service organizations, and our community. And not just finding numbers and doing research, but actually talking to people in the community to see what they need and getting them involved with providing those needs. And in doing that, we need to inspire them to want to be part of that action and make them feel included. So going where they are, going to libraries, public schools, parks, health clinics, food pantries, and actually making them a part of the process, and all of us communicating together in that way.